With pressure mounting on governments as public health experts are calling for new national guidelines on hotel quarantine. Let's go live to the WA AMA President Andrew Miller. Thanks so much for your time. Your argument is that some basic fundamentals are being overlooked here, largely by federal authorities, and the states are rolling it out, but there are fundamental flaws here. Talk us through it.
So, yes, the fundamental error, which has been highlighted by Professor Weeramanthri today, who is a public health scion, he's acknowledged as one of the best in the country, if not the world, saying that our uncontrolled risk is all around airborne spread because of the nonsense that has come from the infection control experts group federally. I've been calling since October last year, along with other people, for that group to be disbanded, because we think if you don't deal with the airborne spread of this virus, you leave yourself an enormous vulnerability, not just in the hotels, but also in aged care and healthcare. And this is being reproduced around the world. And unfortunately, it leaves us very vulnerable, and we've been successful on our borders, but we can't allow any level of outbreak within our community at the moment because airborne spread is completely uncontrolled. We're not giving people top-level N95 masks in many instances for dealing with these positive patients and guests. We're not giving people proper ventilation through their workspaces. And we're leaving ourselves vulnerable to losing this game in the final quarter by not controlling the airborne spread. And unfortunately, it means we've got to get rid of these experts who are advising government at the top and giving them this bad advice.
When you talk about the airborne risk, isn't it true that some of the state jurisdictions have done very thorough auditing of hotels to ensure they have appropriate ventilation? And if so, is your argument that hotels quite simply can't be made safe for a COVID-19 positive person?
Well, certainly Victoria's once bitten, twice shy has now done a lot of work on airborne, and I think Brett Sutton, as the CHO there, has come out and said we really do need to control for airborne spread. The other states are at differing levels, but a lot of them are still relying on this federal guidance and saying, well, they're the experts, we can't go beyond that. So not only the staff in hotel quarantine, but also the people who transport people from airports and so on, and the nurses and doctors who might have to treat them, they're not being given top-level PPE because of this adherence to the dogma around it can't travel more than 1.5 metres, which has been debunked in all the international journals now. So hotels could be made safer, but a fundamental principle with an airborne disease is don't keep people in high-rise buildings or cruise ships or aged care homes where it's stuffy and stagnant. You need to get them to cabin accommodation if at all possible.
And if you look at the situation where return travellers are and you've said that basically innocent people are arriving coronavirus free and then they're getting it in quarantine. You described it as an abuse of human rights.
Well, I think that it's a big thing to take away someone's personal liberty at the best of times, and we all understand that there needs to be quarantine, and most reasonable people will cooperate with that. But if you put them into an environment where the experts have said, don't worry, you can't catch it through the air, and they subsequently do catch it exactly that way, as seems to be happening again and again around the country, you can understand that the people who've given up their liberty to protect the community have been betrayed by the expert advisors to government in those circumstances.